Thank you for joining us again for an educational video. My name is Dr. Scott Whitten from the Nevada Center for Reproductive Medicine, and today I'm going to talk to you about how age impacts one's fertility. Now, I'm going to talk mostly about women because that seems to have the greatest impact on their reproductive status compared to men, but I'll talk about men a little bit too. For women, they're born with all the eggs they're going to have, and they lose eggs throughout their reproductive years until they end up in menopause, which is when there is no more eggs in the ovaries. On average in this country, it happens about age 51. But the ovary just doesn't work great until 51 and then shuts off. The ovary works pretty good until about age 34 for most women, and then it starts to decline in the way that it's working. And when it's declining, what we're referring to is a decline in one's fertility potential, so success rates in getting pregnant start to go down, chances of miscarriage start to go up at that same time frame, and the chance of a chromosomal abnormality within those eggs that are produced starts to go up too. Examples like Down syndrome is a classic example for that. Now, when we start to see women above age 35, we start to get more aggressive with their treatment because we know we don't have as much time, and the more time that goes on, the more difficult it becomes. So therefore, that age group is where you hear women's biological clock is ticking, and it's really the amount of time going on is going to make it more and more difficult for us. So if patients aren't getting pregnant with a certain type of treatment plan, then we're encouraging them to move forward with other treatments that are more aggressive, that you can get higher success rates. And so we might progress through inseminations to in vitro fertilization, something like that. Now there are patients where they've run out of eggs, or they find that the egg quality that they have has declined to such a degree that you can't find any good eggs and good embryos for them to create their family. And so in those cases, there's still options for those patients. We utilize egg donation in some cases where we're using eggs from somebody in their 20s because we don't have any good eggs left, and we can still get our pregnancies from those. Now, the age of the woman when she's carrying is also important. It seems like recently we've been approached by a lot of patients that are older that want to carry a pregnancy. And obviously they know that their eggs aren't good anymore, but they're using embryos from another source. Egg donation, embryo donation, something like that. And so if you're in good health and your uterus is healthy, then it is possible to carry a pregnancy, even when you've run out of eggs. As long as you have a uterus intact, and we make sure that it seems safe to carry a pregnancy. There probably are limits there as to how old should a patient be when they get pregnant. And we put patients through a lot of different testing to try to ensure that they're going to be safe during a pregnancy, such as treadmill stress test, where we put you on a treadmill and make you run, see if does your heart, is it able to keep up with that demand. We also will do things like have you see a high-risk pregnancy doctor to make sure that they go through the risks of pregnancy on a woman when she's older, such as problems with blood pressure disorders, growth restriction of the baby, risks with hormone therapy. All of that needs to be covered in great detail so we can make sure that it's safe for a woman. When you talk about how does age impact a male's reproduction, well, men tend to produce sperm the majority of their life in most cases. However, the quality of that sperm does decline with time, and there are certain age cutoffs that have been chosen where we think maybe it's more significant after a certain age. The age that I go by is age 50 and older, where we start to see some significant changes in the sperm that could then impact one's reproductive outcomes. For example, there might be more abnormalities in some of the sperm related to chromosomes, such as sex chromosome disorders like Turner syndrome or Klinefelter syndrome. We do see that, but it's only a slight increase in those risks. So most of the time, the guys aren't going to change the source of sperm because of the risk that they hear about. Others, they might feel like it's significant and then consider using a sperm donor, but that's pretty rare. So age is certainly important. It affects your outcome, your success rates, and certainly if you are considering getting pregnant and you're worried about how age is going to impact your overall success, you should talk to a specialist. I would encourage you to do so. Thanks for listening tonight. Take care.